Wow. Good afternoon, everyone. This is a little quiet. Good afternoon, everyone. I'm going to use the podium because it makes me feel a little presidential. I like that. So I'm here today to talk to you about City HealthWorks. City HealthWorks is a community-based workforce for chronic disease prevention and management. So over the next 15 to 20 minutes, I'm going to be talking to you about the purpose of City HealthWorks, the solution that we pose, our strategy to achieve financial stability, and briefly we'll talk about our team and partners. Sorry. City HealthWorks is a nonprofit startup organization in East Harlem. It was incubated by the founder and executive director, Mamith Kaur, at Columbia Business School. It was founded to support the increasingly expensive and overburdened healthcare system. It builds upon best practices from the developing world where community healthcare workers are an integral part of the healthcare system, especially in parts of India and Africa where you can have one doctor per every 10 to 20,000 patients. Our three main focus areas are consumer engagement. We seek to demonstrate, oh, I just noticed that this is not changing, sorry. Different slide. Commercial break, folks. We had a little technical difficulties here. It's not moving. It moved on here, though. It's only advancing this. Let me see. I can use the clicker. Doesn't. There we go. Which way was it? This one. Okay. We're back to our scheduled programming. So as I was saying, our three main focus areas are consumer engagement, workforce development, and financial stability. We seek to demonstrate that community healthcare workers are the leading edge of behavior change, disease prevention, and management. We are creating rewarding healthcare jobs in low-income neighborhoods, and we work with hospitals and insurers to demonstrate a payment model. So here we see Clara. Clara is representative of a typical client of City HealthWorks. She's a woman who lives in East Harlem, New York, where our organization is currently based, and she's living with diabetes. So I want to draw your attention to this pie chart here in the corner. This is based on a recent Robert Wood Johnson study that showed that social and economic factors, Yes, so back to the pie chart. A Robert Wood Johnson study estimates that 30% of health is shaped by health behaviors, 40% by socioeconomic factors, and only 20% by clinical care. So that means that only 20% of the causes of Clara's preventable illness are directly addressed by hospitals and clinics. So City HealthWorks seeks to address this other 70%, which are influenced by socioeconomic factors and also health behaviors. So why are we needed? The annual medical burden from obesity rose to $190.2 billion in 2005, accounting for 21% of US healthcare spending. In terms of patients and clinicians, time is a major issue. For clinicians, they don't have enough time to talk to patients and to give them the education and resources necessary so that they can make health-related decisions. And for the patients, they don't have enough time to absorb the health information and support in making difficult lifelong changes. Hospitals and clinics, right now the ACA is imposing fines and incentives to improve the health of populations, but hospitals and clinics have limited experience in population-based health. So an example of this is right now hospitals are getting fined for 30-day readmissions. These fines are really expensive. I know in New York, hospitals have been charged over $1 million for these 30-day readmissions. So they know this is an issue, but they don't really have the internal structure to address these issues, to reduce these readmissions. And for health insurers, insurers are seeking new and scalable ways to engage low-income communities and to help reduce their costs. So this is called the circuit of health. The next few slides will talk about the circuit of health, and this represents our optimum scenario. Ultimately, what we want to do with City Health Works is we want to help people get healthy and stay healthy, and we believe that community health workers play an integral role in doing that. So one of the steps to staying healthy is recognizing symptoms. It's important that people understand their illness and are able to recognize and differentiate between those symptoms that require medication and those that require medical attention. Next, we have finding the right healthcare setting. Patients need to know when it's necessary to go to the hospital and when it's more appropriate to go see your primary care physician. In many neighborhoods, and especially in neighborhoods like East Harlem, we find that people are overutilizing the emergency rooms, and this poses a huge financial burden on the healthcare system. So number 4 is treatment. We want to help patients to be more adherent when it comes to medication. I recently read somewhere that only about 30% of people take their medication properly. Another 30% get the medication filled, the prescriptions filled, but never take the medicine. And another 30–40% never even get the prescription filled. So imagine how much we could reduce unnecessary trips to the doctor and hospital just by getting people to take their medications correctly. And then lastly, we have self-management. Self-management incorporates all of these different factors, and it refers to an individual's ability to properly monitor and control their illness. Successful self-management requires proper education, resources, and support. This is what City Health Works, community health workers that we employ, this is what we seek to provide. We work to complete and maintain this circuit of health. Now we're going to move on to talk a little bit about the solution that we pose. We believe that our health coaches provide the services for the 70% of behaviors and social factors that affect one's health, those 70% that aren't being addressed by our current clinics and hospitals. So at City Health Works, we hire and train clinician-supervised community health workers from the neighborhoods we serve. Currently, City Health Works employs 6 full-time health coaches. It's important to note that our health coaches are salaried employees and do receive full benefits. All of them live in the East Harlem community. Most have lived there their entire lives. In terms of workforce development, it's really important for us to work to professionalize this particular workforce. There are a lot of different community health worker models in the US, but what we found is that there's little consistency in terms of pay rate, in terms of experience, in terms of educational minimals, and also even in terms of training. So City Health Works really sees community health workers as a vital part of our healthcare system, and we also see this workforce as a pathway into the health field. For our particular health coach position, the minimum education requirement is actually a GED, and we don't require any experience in healthcare. What we do look for is people who are passionate, people who are good listeners and have good emphatic skills. It's also really important that they function well in a high-paced environment. We are a startup, so things move really fast and things are constantly changing. Our 6 coaches that we have right now range in age from mid-20s to mid-60s. They come from a variety of educational and professional backgrounds. Most are bilingual, and all of them are connected and very much engaged in the East Harlem community. Our services. Our coaches close the gap between clinicians and patients. This slide illustrates how our coaches work to close that circuit of health. They provide health coaching. Our coaching is based upon motivational interviewing, the American Association of Diabetes Educators' self-care behaviors, and behavioral change tactics. We work to do care coordination. Our coaches are supervised by a clinical care manager. Our clinical care manager is a certified diabetes educator and is also a nutritionist. And she's able to serve as a liaison between our clinical partners and the coaches. And then lastly, we work to address, the social and mental aspects and help to provide support in that area. So this is a great little illustration that shows our infrastructure and shows how we work. One thing that sets City HealthWorks apart is that we are very much integrated into the healthcare system. Right now we have a service contract with Mount Sinai, so we work very closely there with the Department of Internal Medicine, and we have our health coaches actually in the waiting room of the primary care doctors 3 days a week. So during that time, the doctors can personally refer a patient who they feel like will benefit from our services. So here we show that our clinical partners, the doctor of the hospital, can communicate through text messaging. We use a HIPAA-compliant text messaging system called Curator so that we can communicate freely between the hospital and our coaches. And the hospital doesn't have to directly interact with our coaches or contact our coaches. They can contact our clinical care manager with an issue, who then tells the coaches, and the coaches are able to relay whatever information is necessary to our clients. So over on the end here, we see this group of people in the white. That group represents what we call social champions. Once someone enters City HealthWorks, we ask them to identify 1 to 3 people who will help support them in reaching their wellness goals. So this is another way that we try to engage the community, and we understand that people usually are not working and living alone, and there's other people who can help them to reach their goals, and we work hard to engage those social champions. City HealthWorks offers our clients long-term support. Once someone enters the program, they are actively involved for a full year. Clients are assigned a health coach. During the first 12 weeks, coaches work intensively with clients, meeting weekly for about 6 weeks and then bi-weekly. And during this time, this is when coaches are working with clients to help them set their wellness goals. Coaches are also there to address any concerns or barriers that may be preventing a client from focusing on their health. So a lot of times, what we're doing in that first couple weeks is addressing other socioeconomic concerns. We may need to help someone get food benefits or find childcare services, and it's necessary to help them with these issues so that they can actually focus on their health. After the first 12 weeks, coaches meet with clients less often, but stay connected via phone, text, and organize group activities. During months 7 through 12, that's more the maintenance phase, and that's when we really try to involve the social champions so that they can start doing some of the work that the coaches are doing, so that even when a client leaves our program, they still have that social support that they need so that they can be successful in reaching and maintaining their goals. So as I've mentioned a few times, City HealthWorks is community-based. We create a social environment that enables health behavior changes by leveraging social network effects and providing member benefits. So we work with the local community. We partner with other local organizations. The meetings that we have with our clients are held either in-home or in another public meeting place. So if they feel comfortable going to a school nearby or community center, we make those connections with other local organizations and work with them in that way. As I've mentioned, we hire locally hired coaches, and we also work with local businesses to offer incentives and discounts to the people who participate in our program. Now we're going to move on to our strategy to achieve financial sustainability. To create a case for payment, we are conducting a 2-phase pilot in East Harlem in collaboration with local hospitals, clinics, insurers, and communities. We are designing our service model. We partner with healthcare plans and providers. We're currently in phase 1, which we've just launched our 18-month pilot. We're very excited about that. Next, there'll be a rigorous evaluation, and then there'll be a scale up. And we hope to be able to expand to other neighborhoods in New York and also replicate this model in other states. So this just shows the phase that we're in right now. As I said, we are in our pilot phase. Our target populations are adults 18 years of age or older who screen positive for diabetes and who live in East Harlem. Our primary patient outcomes are reduction in hemoglobin A1C, reduction in hospital spending, behavioral economics outcomes, diabetes self-care, medication adherence, and also looking at the impact of this intervention on the members' close relatives, those social champions that I spoke about. We're also working to create a payment model. So we're working right now very closely with insurance companies to figure out what is the right pricing for this. What we hope for is in the future, an insurance company will reimburse us for one of their members being a part of City Health Works and being able to benefit from our services. And we currently have a service contract with Mount Sinai Hospital in New York. Almost done. So our team and partners, our founding technical advisors, the Earth Institute at Columbia University, who co-chairs the 1 Million Community Health Worker campaign, which is a global campaign. We see ourselves as the domestic arm of the Earth Institute. As I mentioned, the healthcare providers that we are currently working with, Mount Sinai Institute for Family Health and Settlement Health. We are working with Health First and WellCare in terms of the insurers, and are in discussions with some other insurance companies and a number of community-based organizations. This is our lovely team. So we believe that by creating sustainable jobs, we can elevate the role of community health workers who invest in behavior change across communities. And we're really looking forward to seeing our model replicated across the country over time. Thank you.